Today we're going to talk about the anatomy of the shoulder and various shoulder pathologies, along with special tests that can help rule in and out these types of pathologies. By the end of this video, you'll be able to describe the anatomical structures found in and around the shoulder joint. You'll be able to identify appropriate test clusters for common shoulder pathologies, and you'll be able to properly demonstrate shoulder special tests to help them better identify common shoulder pathologies.
Let us begin with the anatomy of the shoulder girdle. First, we'll start with the bony structures. The shoulder girdle is comprised of the humerus, the scapula, and the clavicle. The head of the humerus fits in the glenoid fossa of the scapula. Running across the top of the shoulder complex is the acromion process of the clavicle. Surrounding the glenohumeral joint is a fibrocartilaginous structure called the labrum, which helps to stabilize the shoulder and deepen the socket of the joint. Also stabilizing the shoulder are four important muscles known as the rotator cuff. These muscles include the supraspinatus, the infraspinatus, teres minor, and subscapularis. All these muscles attach to the greater tubercle of the humerus, except the subscapularis, which attaches to the lesser tubercle. Now let's talk about typical pathologies of the shoulder girdle. Let's start with impingement. Impingement occurs with a dysfunction of the rotator cuff muscles, leading to a superior migration of the humeral head, compressing the anatomy underneath the acromion, as we can see in our picture present. Tests that help determine if subacromial impingement is possible include Hawkins-Kennedy, infraspinatus muscle test, painful arc sign. Impingement is often accompanied by rotator cuff muscle inflammation, resulting in weakness and pain with static contractions.
Now we're going to go over tests for shoulder impingement. The first we're going to cover is the Hawkins-Kennedy test. First, you'll have the patient bring their arm to 90 degrees of shoulder flexion. Then you will bend the elbow to 90 degrees, internally rotate, and then horizontally abduct. Positive sign is a reproduction of pain. Next, we'll be talking about the infraspinatus muscle test. First, you'll start by placing a towel roll under the patient's arm to keep their arm placed close by their side. Next, you'll have the patient bend the elbow to 90 degrees, slightly internally rotate, and then push out into your hand. Good. A positive sign would be a reproduction of pain or a weak infraspinatus muscle test. The final test for impingement is the painful arc test. You will perform this by having the patient put their thumb up towards the ceiling, starting with their arm by their side, and asking them to raise their arms straight up. A positive sign would be pain in between 60 and 120 degrees.
Next, let's talk about labrum pathologies. The labrum is also a common injury in the shoulder. Labral injuries occur when the labrum is torn or removed from the insertion on the glenoid fossa. It is important to rule in or rule out labral involvement in shoulder cases. If you find special tests to be positive, along with a history of popping and clicking, you may want to refer the patient back to their primary care physician to receive medical imaging.
Next, we'll be covering tests to rule in and rule out labral pathologies. The first one we'll be doing will be the labral crank test. You start by bringing the patient out into some shoulder abduction, compress the joint, and then bring them into full internal rotation, and then bring them back to full external rotation. Then you can explore the joint further throughout different ranges of motion. A positive sign would be popping, clicking, catching, or reproduction of pain. The next test we'll cover is the anterior slide. This is also for labral tears. You'll start by having the patient place their hand on their hip with the thumb facing behind them. Then you'll place your hand on their clavicle and superior scapula to stabilize it, and then place the hand at the elbow, pushing up anteriorly and superiorly. Again, positive signs are popping, clicking, or reproduction of pain. The final test to rule in and rule out labral tears is a patient's report of popping, clicking, or catching of the shoulder.
Today we reviewed the anatomy of the shoulder, various shoulder pathologies and injuries, and the special tests to rule in or rule out these pathologies. Hopefully you found this brief video helpful and enjoyable. Thank you for your attention.